Hey guys, it's Coach Brix.
Coach James.
The game changes. We want to talk about injuries, okay? And this is probably my favorite area to work with people on, okay? Whether it's a chronic disease, injuries, whatever, because I find it fascinating, the human body, first of all, but I also find it interesting how humans can't get over the hump the stump that they're in, because once you get hurt, okay, your body has to change. It's natural. So if I hurt my ankle, okay, my body will still find a way to get me from point A to point B. Now I might have to crawl, I might have to roll, whatever, or I might have to hop, I might have to stumble. Whatever I have to do, my body will figure a way to do it, okay? The interesting part is your body can handle that, okay? It can change and do those things, but it can't do it forever, okay? So if I hurt my right ankle, I will compensate on my left side. I'll put more weight on it. I'll do things on the left side, right? I can handle that for a while, but if I don't fix that as quickly as possible, or fix it correctly, then guess what? I'm going to set myself up to problems later on. And it could be on the opposite side, okay? Because that's been overcompensating in the knee, the ankle, the hip, and things like that. So we could be having issues over there. So the object is, once you get hurt, you got to know how to get back quickly and safely. And the second thing is, you can't stop them. How many athletes do you know, okay, you've seen, have a re-injury or an injury to something else because they stopped doing the things that got them better?
Way too many. Way too many. I probably in the last week, 2 weeks, it's probably been a half dozen or more in the last week.
I mean, and that's just in a week, because people don't heed the advice. Your body is screaming to tell you, hey, I'm hurt. You get it back to a certain point where it's better, okay? But you're not back to 100%. And here's the issue. You don't want to get it back to where it was before because you got hurt, so it wasn't where it needed to be. It needed to be stronger. Okay, so you need to go past that point. Every injury tells me something, okay? When I look at a human being, when I look at James if he's hurt, or I look at anybody else that I have, I look at them as a whole body. Okay, what is going on? Why is there something wrong? Okay? Then I take that approach, okay, we got to attack this, we got to hit this, boom, 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 we hit these areas. And I said, this is now for life. You need to take care of this. Is it going to take you an hour every single time to do this? No. It might only take you 5-10 minutes, but it's got to be a lifelong thing, especially if you're going to continue to play a sport. You got to maintain and work on the things, the areas that you're weak. And that's what the body's telling you. So you have to make sure that you're continually working these things out. You have so many athletes that come back in, yeah, I re-hurt my ankle, my knee hurts, this, that. And you're like, did you do the exercise? No, I stopped doing those. Well, what do people expect? You can't expect miracles to happen when you don't even have the faith to actually do your exercises the way you should do them. Okay? So you got to get into a process of making it like brushing your teeth. Hopefully you're all brushing your teeth. Okay? But make it like brushing your teeth. You just do it. Okay? You just do it. You get up, you do these exercises, you're ready to rip more. My older clientele, who tends to maybe have back pain, knee pain, when I tell them to do something, some guys are still doing the same exercises, okay, that I gave them 4 years ago from an injury they had. They're still doing the same thing. How's your problem? Don't have it anymore. Oh, wow, shocker. Can you come and talk to my young kids that play sports and tell them the same thing because they can't get through their heads? And even parents can't get through their heads. But some of my 70 and 80-year-olds that I work with, they never have an issue again because they're constantly doing those things. They're like, yeah, it takes me 5-6 minutes to do this routine and I'm good to go. It's amazing what the body will do if you just take care of it. But the problem is you don't. You neglect it, you abuse it, you do all the things wrong, and then you expect it to show up for you all the time at 100%. It doesn't do that, okay? So the main process here that we're trying to talk about is, once you get hurt, you got to continue to do the things to get better, and then continue those along the processes along the road, okay? You can't stop. You cannot stop. You got to keep doing it, especially with an ankle. I mean, how many people have come back to us spraining an ankle? They're sprained it once. We fix it up real quick. We get them back. Boom, they're ready to go.
It's normally like a week, 2 weeks later.
Yeah, and they're back. And we're like, when's the last time you did your exercises? And it's like, it's been a month, 2 months, week, whatever. And they stop doing them. Your body will break apart. You have to maintain and keep working on the areas that you're weak. And that's what it's telling you. Okay? Yeah, do you have to work other parts of the body? No question about it. But you have to hit those areas so you don't have issues on other sides. That's what the body just compensates. That's all it does. It finds ways to get by. I have people that I work with who had knee surgery, then they've gone to rehab, didn't really get too much better, complained to me, it's now 6 months later, hey, my other knee's hurt. Why is that? Well, because you compensate. That's why, okay? That's how the body works. And once we understand the body better, and most trainers, most therapists, most people do not understand the body. They just know what's in the book. That's not always correct what's in the book, how the body works. It's deeper than that. And once you understand how deep it is and understand the depth of it, you can heal. And you can heal at a rate much better than everybody else. And then you can get back and you can maintain and continue to get stronger. So what do you want to add into this whole piece of once you get hurt, what people should do?
I think the biggest thing is for people that come in here, just because something hurts one day, we'll have someone come in on Monday and they'll wake up Tuesday and they're like, I have practice on Tuesday. I feel pretty good. That does not mean you're not hurt. That doesn't mean it's fixed. Something doesn't fix in one day and something doesn't break down in one day. Something happened over a long period of time. I know you just talked on with Dr. Joe Thomas, that you don't get overweight in one day. It's a process of years and years and years of breakdown and neglect to your body. Same thing for injuries, where unless we've used the same example before, unless I bash you with a baseball bat, that's the only instance where you're hurt in that exact same moment. It's normally a breakdown. And just because I feel great, my knee feels great today, but yesterday it was bugging me, that doesn't mean my knee's 100%. And we had someone, they like, oh, my knee felt good later in the week. And then they come in the next day and they're like, it hurts, and knee's massive. And they're like, just because it felt good that day doesn't mean it's
because they went back out and played or whatever. They went back to practice or a game or whatever. And they ruined it. And that's, Coach James is right on. You got to understand how the human body functions. Yes, it would be great if I just touched James and he was healed, okay? Doesn't happen, okay? It doesn't happen. You got to understand, okay, what's wrong, and then you got to fix that. And then just because you feel like you're back doesn't mean you are back. You have to test it. You have to see where you're at to see what you can handle. If you can't handle certain things, then guess what? You're not ready to go back yet. And understandable, people might need you, but unless you're playing in the World Cup or the NBA championship or the NFL Super Bowl, unless it's that final game, then I wouldn't technically do that, because you're going to risk doing more damage to your body and you're going to sit out longer and you're going to hurt your team longer. So you got to understand that whole process, and that's one of the things that we try to stress hard with our athletes and clientele is that, listen, your body pretty much tells you what's up. It will honestly tell you what's going on, how it feels, how it moves, but you have to test it. So if my everyday activity, okay, I hurt my knee, 2 days later it feels better, but all I've done is get up out of a chair and sit back down, and I say it feels better, and I'm ready to go play in a basketball game, and I didn't test it, it's probably not the best idea. You want to test it. Give it a couple different things to do and see how it feels. If I do jumps and cuts and it starts to hurt, sorry, then you're just not ready. And the body will tell you that, okay? So the body definitely is the smartest thing out there. We're dumb as human beings. We try to overthink things. The human body knows exactly what it needs to do. It's given the temples by God, so it knows exactly what it needs to do. We just screw it up along the way. So injury recovery, make sure that you guys, take that into account of how to do it properly, so get back quickly, but then you have to continue to do it for a long period of time. It's not just do it till I feel a little bit better and then that's it. You want to get better than you were before. I always talk about that. If you got hurt and you felt you were at 100%, okay, but I got hurt, that means you weren't at 100%. Your body broke for a reason, okay? You need to get it up to that 100% level, all right? And you can't get back to here because this is where I was before. I need to get here. I got to keep working it, keep getting stronger, keep doing the things. So it's a lifelong process. Okay, it doesn't stop. All right, just like eating, you don't stop eating. All right, yes, you might stop for a short period of time, but you go back to eating because you need it, or water, or whatever else you need to do. Okay, guys, this is Coach Brix.
Coach James.
Game changers.